Hey everybody, it's Dr. Brace here, and it's another edition of Facial Plastics Friday where we're going to continue talking about lower eyelids. So today I want to talk about two of the most common lower eyelid benign skin lesions that we treat for cosmetic reasons, which would be xanthelasma and syringomas. Xanthelasma is a cholesterol deposition in the skin which creates little white plaques in the lower or upper eyelid. And these are quite bothersome to people when they happen, but they're thankfully pretty easy to deal with. If the xanthelasma is very shallow and small in terms of its circumference, then these are amenable to laser destruction or liquid nitrogen and even sometimes a chemical peel. And that will remove them and make the eyelid nice and smooth. The problem comes when these are deep, when they're very, very thick, and then we have to think about surgery. Surgical excision of a xanthelasma is somewhat similar to a skin pinch blepharoplasty, where we can gather up the skin under as much tension as is safe and excise it and sew it closed. Sometimes you need to do these surgeries in a staged fashion if the plaques are too big, but often they can be done in a one-shot, one-go surgery. Things to know about xanthelasma excision or xanthelasma destruction is that if you destroy it thermally or chemically with liquid nitrogen, a laser, or a chemical peel, you'll often end up with pigment issues afterwards. Classically hypopigmentation, so it'll look whiter. Your skin will look whiter with less kind of tan pigment in it. And if you are prone to that, you can almost expect it. This is not such a big deal if you're somebody who wears makeup every day, because you can cover it. And the advantage of doing one of these thermal destructions of the lesion is that you'll get a smooth eyelid without having to go through surgery and sutures and all of the healing and the bruising from that process. But you will end up with pigment irregularities, and so it's something to be aware of. I'm not sure of any technique that can be guaranteed not to cause that if you're using thermal or chemical destruction of the lesion, because those techniques will also destroy the pigment making cells of the skin. But if your goal is to have a smoother eyelid without these little depositions of cholesterol, then that is an option. I personally cut most of these out, although I do use a CO2 laser on some of them. We'll show an example here of a lady that had extreme xanthelasma in the lower eyelids in the left upper eyelid, and this was excised, just a direct excision, and closed with a really fine suture. And you can see her at 4 months how she's healed up beautifully, and they're gone. So she's ecstatic and let us share her pictures, and we're also happy for her and excited that we were able to give her that huge change and to boost her confidence. The other lesions I want to talk about are syringomas. Now, these aren't so much an issue of cosmesis in terms of their appearance of being distracting, because they tend to be small and you have to be close to see them, but they cause a bumpy, undulated, kind of uneven surface of the eyelid. So here's an example of a lady that has bilateral, both eyelid syringomas, and the question we had when I was assessing her was, what's the best technique here? Because there were so many of them and they were spread out, it'd be very difficult to do multiple excisions, because the skin in between the lesions would be very small, little small bridges, and it could die, and it could lead to larger gaps in the skin, which would cause the eyelid as it heals to contract and be in a malposition. So we elected to do a CO2 laser resurfacing of the eyelids, doing targeted excision of these lesions so that they could heal up and be nice and smooth. And so you can see her before and after pictures here. When I was talking about hypopigmentation, she has a nice smooth eyelid, but she has areas of white skin. Now, thankfully, she's someone that isn't bothered by this because she can cover it with makeup, and so it was a good solution for her. So those are the two most common eyelid benign skin lesions that we deal with cosmetically. They're pretty simple to deal with in office under local anesthetic, and you can get very, very nice results with a smoother eyelid with less distraction from plaques of xanthelasma or bumps from the syringomas. So I hope that was helpful. Stay tuned for next week. We'll do one last episode on eyelids, which will be the Asian eyelid and creating a double eyelid or an eyelid fold if one doesn't exist. Have a great day, everyone. Bye-bye.